You hear about from so many people about, migraine doesn't kill. It's just a headache or it's just a bad headache. But migraine may not sort of, kill you or be known for killing you, but to have a situation like that a complication that leads to a life-threatening surgery, which she was only hours away from widowing her husband and her 3 kids. I mean, can you imagine how devastating that would have been?
Yeah, it was painful for me because it just brought back all of my hospital and emergency room experiences, and hers was far, far worse. And it brought back my own recollection of, taking so many Excedrin migraine, frankly. I lived on them for years, and no one ever told me that could create a rebound or medication overuse situation. Welcome to our new series, Me versus Migraine, in which we dive into the compelling stories of real people who are battling this disease. Now, in each episode, you're going to take away some insightful nuggets to make living with migraine a little easier and less painful. I'm Paula Dumas, producer of the Migraine World Summit and editor at large at Everyday Health and Migraine Again.
And I'm Carl Cincinnati, founder of the Migraine World Summit and director of operations at Migraine Headache Australia. In just a minute, you'll meet our friend, Wendy Neary. For the first time, she shares how a family trip to Disneyland ended up with her in the emergency room with a life-saving operation due to a complication from migraine.
But first, we'd like to thank the sponsor of this episode, Amgen, a company that strives to serve patients with therapies that have the power to restore health or save lives.
Wendy Neary is a true migraine warrior who's been living with migraine nearly all her life. Based in Arizona, she's an editor for the website Migraine Again and has been a content editor for the Migraine World Summit for the past 4 years. She and her husband have 3 daughters, including twins.
And when Wendy's not writing, she's pretty active, hiking, yoga, walking with her yellow lab, Cheerio, great name, taking family road trips and traveling anywhere that there's a beach. And she chills out with a good book, or The Real Housewives, or a good podcast or webcast on health. And what she's learned through her life-threatening disaster just might save you from experiencing a similar fate. So I'd like to welcome Wendy Neary. Hey, Wendy.
How you doing?
Good. Thank you for having me.
We are thrilled you're here.
We're going to jump straight into the questions. When do you remember your first migraine attack?
I was 8 years old and it was picture day and my mom made me wear a headband. And so we just thought that it was because of the headband, but I had many more after that.
I don't know how many women could attribute their migraine attacks to a headband, but probably a lot. So did you see anyone for treatment back when you were a child?
Just my regular family doctor. And the first question he asked my mom is she a straight A student? And my mom said, yes. And he said, well, that's why. So that was really my first experience in someone saying it's because of you. It's something you're doing.
Interesting.
What medications were you given or advised to take?
At that time, really throughout that time, I just took aspirin. There was nothing really migraine specific. Well, there was nothing migraine specific. There was something at the nurse's office, but I don't even know what it was. Some peppermint syrup and warm water and crackers. And that was about it. That was when I was young.
There's so few options for kids. The most dramatic part of your story happened during a family trip that you took to what's supposed to be the happiest place on earth, Disneyland. Tell us about that.
Well, we were taking our daughters to celebrate their middle school graduation. And it was the second day of our trip, and I woke up with a migraine attack. And in those days, I didn't immediately take my sumatriptan or my rescue meds. I took more over-the-counter things and then held those in case it turned into migraine. So it already was becoming a migraine, but I took a lot of medication that day while we were at the park because it was a very busy day. And it was only the second day and I didn't want to ruin our vacation. So I just medicated about every 2 hours. I layered Excedrin, Advil, Tylenol, maybe not Tylenol, maybe even Aleve, and then some sumatriptan. But I thought I was being safe because I was taking it every 2 hours or so. And then that night we got back to the hotel and my stomach was hurting, but I thought I would just go to bed and sleep it off and feel better in the morning. Well, at about 2:30 in the morning, I could just tell this isn't just a regular stomach ache. And I was in tremendous pain. And, as migraine people, we're used to pain, but this was a pain worse than childbirth, worse than anything. And when I got up to try to use the bathroom, I couldn't, I felt dizzy. So I woke my husband up and I said, something's really wrong. We need to go. And I'm not an ER type person. I don't normally go. So he knew I was serious when I said that. And we went I could barely walk. We woke one of my daughters up and said we had to leave them. My twins had just turned 14 and I had a 6-year-old. So we had to leave them in this hotel in the middle of the night. And my husband looked on the phone and it directed us to the closest medical center. Little did I know that place also served the Orange County prison system, and it was also a mental hospital. So they gave me a bunch of morphine. I was vomiting, and they spent about 7 hours trying to figure out what was wrong. And with every doctor that came in, they pushed my stomach even harder. And it was really, really painful.
Oh my gosh.
So finally they ordered a CT scan and I came out of there. And then now this is about 7 hours later. So now a colon surgeon comes in. There was a language barrier, so it was hard to understand. And he had completely no bedside manner, which I would come to find out. And he said that it might have been that the pathologist saw free air on the scan.
But let me pause you there. What does free air mean?
Free air would indicate the possibility of a perforated intestine. So he saw the free air. So then the day shift pathologist came in and said that he didn't see free air. So at that point, the surgeon said, well, let's just do a colonoscopy. And my husband stopped him and said, this doesn't make sense. Why would one person see it and the other one doesn't? So then the doctor left for a while and then he came back and he said he ordered another CT scan. That scan showed definitely the presence of free air. And he said that I needed immediate emergency surgery. And he told me that I might wake up with a colostomy. And I did not know really what that was. I had a vague idea.
I'll bet half the people listening to this story right now don't even know what a colostomy is.
Well, a colostomy is when they take a portion of your injured intestine and then they cut that off and then they make an incision in your abdomen so you have a hole in the outside, and then they pull the healthy intestine through, and then the end of that is called a stoma, and then you have to have a bag on the end of that.
A bag outside your body, right?
Yes. Yeah. Yes. But I didn't want to get too ahead of myself, but turned out I did wake up with that. And so I woke up in the ICU and the doctor spoke with my husband and he said that there was so much infection in there and that if I would have waited another 2 hours before coming in, that I wouldn't have made it. So, sorry.
That's incredible, Wendy. I mean, I just want to thank you for your courage in sharing this. It must be difficult bringing up these memories.
It is, but it's good because I don't want this to happen to anybody else. So he actually said to my husband that it was what he said that made him think about it again. And that's why he ordered the other scan. So I attribute both of them for saving my life. And my husband really was my advocate because I was pretty much drugged out on morphine. But I do remember waking up in the ICU, and they let my children come in and say goodbye because they had to go back to Arizona. My in-laws came and drove from Arizona right away and picked them up. And I just remember my 6-year-old daughter coming in her Minnie Mouse dress because she thought we were going to Disneyland later that day after mommy's tummy ache got better. And that didn't happen. I ended up in that hospital for 10 days, and it was the worst 10 days of my life. I was so weak that I needed to have physical therapy just to walk. And I had to have a nasal gastric tube up my nose into my stomach. So after 8 days, the surgeon with no bedside manner came in and without warning, literally yanked the NG tube out of my nose like you would pull a cord out of a vacuum cleaner or something, like out of the wall. And that was really painful. Like it goes down to your stomach, and he just yanked it. And then 2 days after that, when he decided that I could go home, he again came in, and now he yanked the drains out of my stomach. And with no warning, he just completely yanked those drains.
There are several levels of pain to your story. There's the pain of destroying a family vacation and the guilt that comes with that. There's the pain of landing in a medical institution where things are not necessarily done the way you would expect them to be done with a level of professionalism. There's the pain of realizing I could have died. And we spoke to some doctors and they said, yep, with this story, she could have died, right? And you never attach that to migraine. And then there's the extraordinary pain of waking up with a colostomy bag that is going to be processing all of your food for the rest of who knows how long, right?
Exactly. I didn't know how long. And when the doctor discharged me, he said, you better find a doctor in Arizona who can reconnect you. And I had no idea, how I still was in a pain medication fog. I didn't know how I was going to do that. And he gave us very, very strong warning about driving home across the desert to Arizona. He told my husband, you better know where every hospital is along the way. And we didn't really know why, we didn't know what was going to happen, but he gave us that strong warning. And to this day, my husband still has them marked in his phone. We did make it home eventually. And of course, I was very happy to see my kids, but it was a long road to recovery.
Yeah, I can imagine. Well, I'd want to pause for a second and just remind everybody that the reason why we're telling this story has to do with the origin of migraine and what you were taking for migraine that caused this whole disaster to unfold in your life, right? And let's go back and talk about that for just a second. What were you taking at the time, and how did you connect that to the colostomy that you ultimately had to have?
Well, at the time, my rescue medication was sumatriptan, and I had that on board. And I also had spent years taking a lot of NSAIDs and aspirin, and mostly Excedrin. And the Excedrin definitely caused rebound headaches for me. So I was medicating for not just migraine, but headaches. And we know there's a difference between those. And when I was taking all of the caffeinated Excedrin, it was creating headaches, not migraines, but sometimes those headaches turned into migraine attacks. So I took far too many of those for many years. And once I got home from the hospital from Anaheim, I really didn't leave my house a lot because of my I felt disfigured. I felt gross. And I also didn't want to leave with not knowing what could happen. Having a colostomy is very unpredictable. And so I spent a lot of time just researching how could this have happened. And I came up with a few studies that said, they used to think that it bothered only the stomach, those things, but it actually weakens the intestinal walls. And it definitely could lead to perforation. So I connected those dots, and I just felt that's what happened. Nobody knew how much, no doctors really knew how much I was taking.
So no one asked you how much medication during all the doctors that you saw throughout your life?
Well, they would ask, but I always fell into the category of episodic. So if and in those days, I would count not migraine days, but a migraine attack. So maybe I was more chronic because a migraine attack will last several days, and then you have the hangover and the prodrome phase before that. So, those days should be counted, but I didn't. So I was just treated as if I had episodic migraine, which that is what I have now that I've gotten, don't take those over-the-counter things. And I did see a headache specialist right before this, about 2 years before this incident. And he put me on topiramate. And I could only be on that for about 2 weeks before I couldn't think. I had brain fog. And, as a parent, and I'm a writer, I can't really afford to be that way. And then pretty soon I started having suicidal thoughts. And so I told the doctor what it was doing, and he immediately took me off and said, okay, here's what we're going to do. The next time you feel the whisper of an attack, take 3 Advil. So I thought that sounded a lot. And I had given him a spreadsheet of how many attacks I was having, and he knew exactly what medications I was taking. And so he said 3 Advil. And I thought, well, that sounds like a lot, but if he said it, I guess that it must be okay. So that is what I did on that morning in Disneyland, and many other days. I would take it on an empty stomach first thing in the morning, and then sometimes throughout the day.
I can think of probably half a dozen times where I've had a really important event or a day where I have to be well and functioning. And I've done the same thing on an empty stomach as well. And I think there's a lot of people watching that have probably done the same thing. So what do you think sort of happened? Why did it happen to you? And is this happening potentially to other people?
I don't know why it happened to me, because I did read that it is rare that it happens, but I do feel that, I have had a clean diet most of my life because of migraine. I don't drink. I don't eat food with preservatives. It's a clean diet. So that wouldn't lead to anything like diverticulitis, like the doctor in Anaheim said maybe that was why. So in what I feel why it happened to me is because I was overusing these medications. And then I don't know if that day in Disneyland was just the perfect storm, and my intestines maybe were weakened already from years and years of this. And then that day I just really piled them on, and maybe that's just what did it.
Wow, that was an incredible story. Perhaps one of the most incredible stories I've heard associated with migraine. You too? Did you feel that way?
Yeah. You hear from so many people about, migraine doesn't kill. It's just a headache, or it's just a bad headache. But migraine may not sort of, kill you or be known for killing you, but to have a situation like that a complication that leads to a life-threatening surgery, which she was only hours away from widowing her husband and her 3 kids. Can you imagine how devastating that would have been?
Yeah, it was it was painful for me because it just brought back all of my hospital and emergency room experiences, and hers was far, far worse. And it brought back my own recollection of, taking so many Excedrin migraine. Frankly, I lived on them for years, and no one ever told me that could create a rebound or medication overuse situation.
Yeah, I mean, I've taken a truckload of aspirin over my migraine journey, and that does the same kind of damage as NSAIDs. They're really, like, on an empty stomach, they can rip your gut apart. And I think we have an expert, actually, Dr. Trupti Gokani, who spoke about how the gut can be affected by OTC medications.
Why don't we take a quick look at that?
At a certain level, when you take anti-inflammatories and steroids, your own flora, your gut microbiome cannot coexist with repeated uses of OTC like Excedrin, migraine, ibuprofen, steroids for sure. It'll create damage to that lining. And not only the bugs will be damaged, but also the prostaglandin layer that actually is the home for the bugs to grow. So what I tell my patients is, if I keep prescribing that to you, how am I ever going to get you to resolve your pain? We might get rid of this acute attack of pain, but what's going to happen 3 months down the road, especially when you get 5 days of steroid? And my concern is that, am I doing more harm than good as a doctor, right? I took that Hippocratic oath, right? I don't want to do more harm than good.
Yeah. So, like, our gut health can be directly affected by what we put in it, right? Which is food, but it's also the medications and the drugs and even, supplements and things like that. So, I just don't remember ever getting told by doctors about just, that relationship and how much damage can be done.
I really don't want to create harm. The triptans, of course, thank God we have non-oral delivery, injectable, nasal delivery. So there's all these really great ways of getting the medication in. And thankfully, the pharma companies are helping us with this. So we really don't have to worry so much, because there is an awareness now of this. And so what I would ask everyone is just be careful, be mindful of what you're taking, because you actually can be creating more harm than good. Even though acutely you may feel better, I'm telling you, I've watched this for 15 years, you often will get worse down the road.
Well, you talked about seeing a few different types of doctors over the years for migraine, and then ultimately landing with a headache specialist. At any point, did your endocrinologist or your OBGYN or your primary care or your headache specialist say, hey, Wendy, maybe taking too many of these over-the-counter medications would be unsafe for you?
No, nobody said that it was unsafe. I did have a primary care physician who immediately wrote me prescriptions for an antidepressant, a beta blocker. And at this point, I knew that my attacks were hormonal, because when I was in college, they became monthly on the dot. And then when I had my children, I had blissful pregnancies with no migraine. And then when I would be finished with breastfeeding them, I would go right back into it. So I just knew there was a hormonal component, and I wanted to treat that underlying rather than get on other medications that might give me more side effects. So nobody said that I was taking too many.
Well, the good news is today that we have more medications that can be used that are specific to migraine for acute, and we have more options for prevention that don't necessarily have the same side effects that you experienced in taking topiramate, for example. So that is something we can all be grateful for, undoubtedly. But I think that this pattern of a lot of people taking NSAIDs and thinking that they're harmless is the reason why we felt it was so important to tell your story. And you did say, this was a rare occasion, and that is consistent with the research that's out there. It's rare, but it's real. And if we can save one other person from having that experience, that would be good. The other issue that came up in Wendy's interview was that you're told by physicians sometimes, or you don't even consult a physician about taking NSAIDs and Excedrin migraine for acute care, when there are other migraine-specific options that might not be as tough on the gut, right? Dr. Steward Tepper addressed this during the Migraine World Summit when he talked about pain medications causing rebound or medication overuse.
The other pain medications, the over-the-counter medicines, the anti-inflammatories, those can also transform migraine. They're obviously a double-edged sword because used effectively and infrequently, they can be helpful. But once people move into the 10 to 15 days of use range for any pain medicine, that pain medicine can worsen the migraines. And one other point that I always make to my patients, it doesn't matter what you're taking the pain medicine for. Even if you're taking the pain medicine, let's say for low back pain, the brain does not know the difference. The brain does not know why you're taking these medicines. So it's the frequency of use and the type of medication that is associated with the transformation.
Yeah. And I mean, how many doctors have talked to you about rebound headache? I've never had anyone tell me about it. It's only been, through, the expert interviews that we've done where we've really explored that sort of subject. And that caffeine, particularly caffeine with people, in people that have migraine and the susceptibility, caffeine may not cause a migraine per se, but if it causes a tension headache, that tension headache can fuel the inflammation or a cascade of a physiological response in the body that can lead to migraine. And it just doesn't get mentioned it just feels today that consultations are so short. You get in, you get diagnosed. Once they know the diagnosis, they'll throw a prescription at you and you're out the door before you kind of really know what's happened. And then you're on your own and you've got this prescription to fill. You go to the pharmacy, there's a line at the pharmacy. It's a quick interaction. Have you used this before? Yes or no? And you're off again. And then, you may not see the doctor for months or longer.
Yeah, that's true. The other issue is the coordination of care between different conditions. So many people in our community have migraine and then they have something else. And for that something else, many of those things are pain conditions. So in my case, I have back pain, right? And many days I would take something like Aleve for my back pain. And I wouldn't count that in my diary as a migraine medication because I didn't take it for migraine, I took it for back pain. But your gut doesn't know the difference. And that was a big aha moment for me when I heard that on the Migraine World Summit in one of our interviews was, my gosh, that's me. I'm doing it wrong. You talked about this life-threatening medical event that almost killed you and almost left behind your husband and your 3 kids. And it's taken you years to recover. Tell us a little bit about that physical recovery and the emotional recovery.
Well, luckily, after 7 months of having this colostomy, I was one of the fortunate ones who was able to have it reversed. And when I went back for one of my follow-up appointments, I said to the surgeon, because now I've done all my research, and I said, do you think it could have been from all of the medication and NSAIDs I've been taking over the years? And he said, no, absolutely not. He was very dismissive about it. But then again, he's a colorectal surgeon. That's not his focus. He doesn't know one thing about my head migraine history. He didn't know what medications I've been taking or for how long. He just said immediately, no, it's not that. And then recovering from that wasn't as simple. I ended up having 2 hernia surgeries, and then I ended up having an entire abdominal resection. And that surgeon said, oh, this is common. He said, a lot of times doctors will tell you a colostomy is a 6 or 7 month process, but it never is. There's always another at least year or 2. So I did eventually heal physically. There were a lot of complications with that. But then after I healed from that, then I really needed to heal mentally because, like you were saying, Paula, there's so many layers. Then after I got done with the physical part, so then I had to go I decided to go see a psychologist because I needed to get past that and all of the trauma that happened at that center and the trauma of almost losing my life. And I I'm still get emotional about it. So I can't say I'm completely past it. And it's always there. I mean, it was the worst time in my life, and it was the worst medical experience that I hope I ever have.
It sounds to me like you were treated like a criminal at that hospital that day at after the day at Disneyland, and before that, even seeing the headache specialist, I think you were failed by several doctors who didn't ask you about the treatments that you were taking or the frequency in which they were taken, or even provide you instructions about how to take them. And even at the pharmacy level, when these if there's for the purchase of sumatriptan and other prescription drugs, they should be telling you how to take that. And how many of us have read through the entire label inside a pill packet for all this stuff? It doesn't happen a whole lot. And maybe that tells you advice to take with food. It doesn't say must take with food. So, I mean, it's kind of astonishing that that all these failures led to such a horrible experience. And you're incredibly brave for sharing what you've been through, Wendy. I wanted to thank you for that.
Thank you. And I also wanted to say that when I did go back for my reconnection, and what was the medication they gave me? NSAIDs. And I said, I'd really not like to be given these. And, when you're in a hospital, that's just one of the things they give you, and they really load you up. And that was the last time that I've had any NSAIDs in my body. But I thought that was ironic that that's what I think caused it. And then they give me more.
Wendy, what would you encourage anyone watching to take away from your experience? What little lessons or nuggets would you pass on to someone else who's watching this?
Well, actually do read those labels and that come with your medication, and, read the warnings. I wouldn't tell anybody to not take NSAIDs. I just personally don't anymore, but I know there's a lot of people that need them. And I would say what I say to my daughters who need to take them sometimes for migraine themselves or cramps. I say, never on an empty stomach, eat something first, and then watch how many you're taking. Do not take more than the recommended amount in a day. Space it out. And if you find that you're getting into an overuse pattern, address that with your doctor. And also, there's a lot more migraine specific medications, like you were saying, and devices that I didn't have available to me. Some of these are just a few years old, and really educate yourself and look into these things, and don't trust everything that your regular doctor tells you.
Very well said.
Yeah, I couldn't agree more. I think that it just underlines how important we are in our own healthcare management and medical error. We don't necessarily hear a whole lot about it, but it is surprisingly common, and we don't want to be the victim of that. And I think that's where we have a role to play in our own healthcare and our own self-education. It's something that if you didn't, most people wouldn't know what they don't know, and unless it was explained to you by a doctor. I think there's a lot of people out there that are still overusing medications and are still in medication overuse headache, which is not our fault as a patient. It's the doctor's fault for not telling us or not instructing us on how to use the medications properly.
Dr. Andrew Charles talked about this a couple of years ago in the Migraine World Summit, where certain over-the-counter drugs, especially those containing caffeine like Excedrin migraine, can do more damage than we even realize.
The other ones that we see issues with, and the evidence about this is mixed, but my own impression is that the caffeine-containing analgesics are ones that are worse for migraine patients. So Excedrin, basically, or Excedrin migraine, which are essentially the same thing. Mm-hmm. Those are ones that we often see people getting really attached to, mm-hmm. And in ways that really it makes it seem that this is making the problem worse.
Yeah, and this brings up the whole issue of prevention. And we've spoken with our community before about prevention and acute treatments, and like, how do you treat every attack at the first whisper when you only have 9 triptans and you've got 15 plus attacks, right? It's really, really difficult. You speak to a headache specialist, they'll say you need to do prevention. And then the patient will then say, well, yeah, I've tried, nothing works. Or maybe you're like Wendy, where you try something like topiramate, you have a really awful adverse reaction, you can't do it. And there's this tension between preventing attacks, trying to prevent attacks before they occur versus treating them acutely. And what do you do when you run out? And I think that Wendy was let down in another way by not having other preventive options. I mean, she was getting treated, this was, years ago, over a decade ago, but there were still other preventive options available at that time, other classes of medication that weren't an anticonvulsant like topiramate, which she was prescribed. And today, of course, as we all know, there's many, many more. There's the anti-CGRPs, there's the G-PANTs, there's devices, there's whole categories. But prevention wasn't really, it wasn't really something that came up in her treatment plan. And at the first sign of failure with one of the drugs that failed Wendy, it was abandoned.
Yeah, well, she said she was taking topiramate and beta blockers, right, for prevention. And those are still more heavily prescribed than the CGRP medications that we now have, the monoclonal antibodies that came out starting in 2018. And those don't even go through the oral system at all. Those are injectable or intravenous. So those are really fantastic options. And then the G-PANTs came out and also are helping many people. It's just that sometimes the doctor doesn't mention it, or sometimes you have to fail one of those other generic, less expensive drugs before your doctor will even mention those therapies because of the way people's insurance works. So we've got a lot of work to do on that, but I feel like we're making a little bit of progress on that front. And I think there are now new non-oral medications for migraine. There are nasal sprays, there are injectables, there are sublingual medications, there are devices that can abort an attack if it's relatively mild and caught early on. And so we have a lot more things in our toolkit than we ever had before, but people don't really think about that as often.
Yeah. I think the other thing is, I mean, I certainly in, where I grew up, like the doctor was kind of, this elevated position and authority in your life and in your healthcare, and to question someone, to question a doctor was almost like blasphemy. And I just think it's such a shame that, Wendy almost had a near-death experience to sort of go through that. And it was the same with me personally. It was 7 years of chronic migraine and all the misery and challenges that brought that finally shattered that paradigm of, the doctor sort of knowing all and being able to help me. And it wasn't really, it wasn't really until that changed and I started to sort of learn more myself and take more ownership. Not that it was my fault, but that I had to kind of be part of my own recovery. Did I start to turn the corner myself?
Yeah, likewise. I don't even look at a doctor the same way anymore. I look at myself as being in charge of my own health, and the doctor as being the expert who can help me get from where I am to where I need to be. So, and, Wendy did a lot of her own research, and that was important too, in order to find some of the answers that she wasn't getting from the doctor.
Wendy, I just wanted to thank you again. You've been you're an amazing advocate. You're courageous in sharing this really deeply personal story, and you've been an amazing contributor to Migraine Again and the Migraine World Summit over the past few years. So thank you very much for that.
Thank you. I've actually learned so much from the Migraine World Summit that after I got back and all of this got done, that's when I got involved with the Migraine World Summit, because I knew I just needed to take this into my own hands and really learn a lot. And that first summit I attended, I blocked everything out for a week. I just tried to learn as much as I can. And in one of the summits, I learned, that I was doing a disservice to myself by waiting to take my my rescue medication and taking it, waiting too late, because we only get 9 pills a month, and I was rationing them and taking far too many of the over-the-counter things. And so I really have learned a lot from the Migraine World Summit every year that helps me as much as it helps other people. So thank you guys.
We appreciate you and everything you're doing as an advocate to help other people. And today, I'm sure will help many, many people. So thank you for your courage to share your story. And we wish you better health in the years ahead.
Thank you.
All right, we're going to open now for Q&A. So if you've got a question that you've been holding on to, now's a good time to drop it into the chat. And we've got Wendy here as well with us, and she'll be able to help answer questions as well about her experience. But Paul, I don't know if you noticed, but as I was reading through some of the chat and some of the questions, a lot of people in the audience are going through challenges with their gut and with taking medications.
Oh my goodness, it is so common out there. So really excited that we're focusing on this for our first Me versus Migraine webinar. And first thing I wanted to do was also to remind everybody that we are not doctors, and this webinar doesn't constitute medical advice. So what we're going to talk about here is to answer many of your questions as best we're able and discuss about some of these things. We're going to share with you what we've learned from the medical experts that might help you to understand this disease, and then have a more productive conversation with your doctor at your earliest convenience. So let's kind of kick off and talk about our use of over-the-counter medications. Carl?
Say that again, sorry. Use of over-the-counter medications?
Yeah, use of over-the-counter medications. I guess the first question I would throw out there is, have you ever experienced or taken over-the-counter medications for migraine on your own, or that a doctor recommended? And here we're looking to hear in the chat some of your comments about whether you take over-the-counter medications, what kind you take, and whether the doctor recommended them or not, or whether you just were kind of self-treating. Someone else thinks that it's merely a headache, and some drugs really affect our organs too. So many GPs have no awareness and therefore offer no real solutions. And so I think this really raises a point of where we need to go in, and when the doctor says, how have you been doing? Don't just talk about the number of headache days that you've been having. Talk about what is happening to your gut as a result of maybe the migraine, like if you have abdominal symptoms or IBS or IBD or diarrhea, and any irritation that you notice, any response to different triggers. Talk about all the gut issues that you experience with whoever is treating your headache doctor, or whoever is treating your migraine, whether that's a nurse practitioner or a GP or a neurologist or a headache specialist. They need to hear all that stuff.
Yeah, and I can see just a very similar sort of example from Suzanne, who said that she developed gastritis, even though the doctor knew they had serious migraine issues, and didn't suspect that it had anything to do with her heavy use of ibuprofen and acetaminophen, as an example.
Larry said that he takes a Tylenol headache at the onset of a headache, and then sumatriptan when I know it's truly a migraine. And I was doing the same thing, Larry. I was kind of rationing my triptans quite a bit. And my migraine doctor says, come on, after, several decades living with migraine, don't you know when it's a migraine? And if not, why don't you take the migraine medication? And at that time I was taking sumatriptan as soon as you know. And that, of course, brings up the whole economic argument of rationing your triptans and all of that. But he really encouraged me to take fewer NSAIDs and more migraine-specific medications.
Kerry had a question, very easy one to answer. Will this be recorded? Yes, it will. We'll have a replay available for at least a week after today. Just reading through a couple of Q&A questions as well. Jasmine had a question about what type of medication class did she say And I believe it was, Wendy, do you want to answer what kind of medication, what class you were taking that you think caused the problem?
The NSAIDs, you mean?
Yeah. Was it just the NSAIDs?
The NSAIDs, but I think aspirin is considered an NSAID too, if I'm not correct. I think so. So I think it's just a combination of all of those that just really damage the gut lining. And
that raises a good point. If you're curious about,
I don't think it's designed to be taken without food. There are some types of aspirin that are encoded, so the tablet's supposed to be less harsh on the gut. But I would say, do your own research, speak to your doctor about, whether that's a good fit, and if it has absolutely no effect, or if it still has some effect on the gut.
Mary asked a pretty important question. She said, on opioid usage, I take about 4 a month. Why do doctors constantly lecture me about the potential abuse? I'm 74 and I don't believe I will get addicted. And that is a great question, Mary. And definitely opioids have their place in pain management, but there has been such a national global epidemic about opioid overuse and addiction that physicians are extremely concerned about it. Sometimes it can be a very slippery slope. And I have learned independently that some of the opioids that are out on the market right now are not as safe as they used to be. So I would see if there are any other options that are available to you that might do the trick. For migraine, there's some migraine-specific medications like G-Pants and triptans that are not going to cause you any risk of addiction. So consider
Wendy,
that.
we've got a question here from Angie Glazer. What kind of a doctor was it that recommended you take 3 ibuprofen at the first sign of an attack? Was that a headache specialist? Was it a family doctor or general practitioner?
it was a neurologist who did specialize in headaches. In fact, his clinic was called, well, I shouldn't say it, but it had headache medicine in it. So, and also I did express my concerns about it being a causing rebound headache, and he assured me and said, "Oh no, there's no studies that show that it causes rebound. You'll be fine." He didn't say anything about the gut, and of course I was concerned about that, but I was A, desperate in pain, and then B, I just believed him and thought, okay, well, it must be okay if he's telling me I can take, 3 at a time, 6 hours apart, and that's what I did, and I did that for about 2 years, and I believe that probably led to the perfect storm that happened in Disneyland. And I don't take any of that anymore at all. And actually, I think my headaches, not migraine, lessened once I got myself off of all of that and aspirin.
Another question from Jasmine Rossi. Do you follow any sort of specific diet plan at the moment, Wendy?
No, I just, like I said, try to eat a clean diet, and I just try to, follow the seeds method that we've learned so many times in the Migraine World Summit, trying to get good sleep, exercise.
This is my neurologist placed me on topiramate as well. And like you, Wendy, I experienced brain fog and a reduction in my speech and ability to focus. So my neurologist said it was probably work, burnout, other factors. I love it when it's our fault. I advocated for myself and I asked to try something else. And he said to continue this medication. So I decided to wean myself off, as I knew it was causing more harm than good. So I guess fantastic for you for being your own advocate and asking for things. I will say that topiramate for some people does cause some intolerable side effects. And so if you're taking something that's causing intolerable side effects, then you have to let your neurologist know. Don't just sort of take it into your own hands or whoever is your healthcare professional. And then there are so many options. We have gotten a variety of things these days that are available to us. Sometimes your insurance won't cover them until you fail something like topiramate, which is now generic. It tends to be a less expensive medication. But we have devices. We have a number of different, G-pants, for example, are now a preventive medication. If your acute medication is doing the job it's supposed to do, you may not need as many preventives. It really depends how frequent you are. And there's behavioral therapies. There's a whole migraine treatment map and treatment directory that we published as part of the Migraine World Summit. If you don't have that and you're trying to figure out what else should I take, go to migraineworldsummit.com and you can see that, because we update it every single year to give people the range of options that are available to them today.
A quick heads up. A few people have been asking about how they access the recording for the webinar. We're going to be sending out an email. An automated email goes out to everyone who attended and to those for those who didn't attend. So you'll get that via email. We'll also be sending it out through our next newsletter that's coming out tomorrow morning, Tuesday morning, US time. There'll be a link in that, and then we'll also be able to share it on social media as well, so everyone can get access to the recording. Paula, one other question from Bradley, which I think might be for us. He said that if someone can only take rescue meds 3 times a week and no NSAIDs, does that mean we have to suffer through all the other days that we have migraine?
If someone can only take rescue meds 3 days a week, do they have to suffer? Is that the question?
Yeah.
Yeah.
And no NSAIDs.
And no NSAIDs. So this really brings up the role of prevention in the migraine plan. A lot of the professionals, the American Headache Society, International Headache Society, are now saying if you are having attacks more than 4 to 8 days per month, so count your days, track how many you're having. If you're having more than 4 to 8 days per month, you should be on a preventive medication, because you're having to take too many acute medications. And this was me to a T, right? And the preventive medications I was taking were not doing their job. So if you get prevention mastered, you will have fewer acute medications that you need to take. And therefore, this NSAID problem will be less of an issue. And again, there's a whole section in that treatment directory that we talked about, which goes into prevention. We go into this in great depth.
They're not used properly and not used appropriately over time. And if something works for us and we don't notice any acute symptoms, we keep doing it for years, it can escalate into a real problem later on, as a lot of people, not just Wendy, but a lot of people in this at the webinar have sort of highlighted. So I think it's about having an informed conversation with your doctor, putting together a treatment plan that includes, as Paula said, both prevention as well as acute. And there's a number of options in both areas that you can sort of work with your doctor to develop.
And drug-free options too. So devices and behavioral therapy, for example, and the SEEDS protocol that Wendy talked about. There was actually a study that said that exercise was more effective and a high omega-3 diet more effective than some drugs. So you don't have to be completely dependent upon drugs. You do have options. And those are good things to discuss with your doctor. So Gwen asked something about stomach migraine, because apparently a couple of people have been told that they've had stomach migraine. Carl and Wendy, are those terms that you've heard from your doctor as well, stomach migraine as opposed to abdominal migraine?
I haven't.
So I will share a personal anecdote. I had all kinds of crazy stomach issues, from daily vomiting, cyclical vomiting, to distension for about 11 years before I had a concussion. And I presented as a traditional migraine patient with headache as a symptom, right? And I didn't get diagnosed for those first 11 years because I was just experiencing abdominal migraine. And there are days now that I'm much less severe than I used to be, where I will just have gut problems. So that might be what you're hearing from your doctor, that you're experiencing stomach migraine. The technical term is abdominal migraine. And I believe in the chat there was a link to an article on abdominal migraine. You can also search on abdominal migraine within the Migraine World Summit and find a whole bunch of resources on that to help you understand it better.
Excellent. Well, we've got questions still flowing in. Unfortunately, we are out of time. I want to thank Wendy Neri again for sharing her remarkable story and having the courage to come forward and do that. If any of you have an amazing story that you think really needs to be highlighted for others to learn from, please contact us. You can email us from our website. You can contact us on social media. Let us know. We want to hear from you. These are important stories that more people need to hear about. But Wendy, thank you. We really appreciate you sharing your story and taking the time today.
Thank you for allowing me to tell it. And thank you, everybody, for listening to it. And I really hope that it resonates with people and maybe make them rethink I don't want this to happen to anybody else.
You did a good deed today, Wendy, and we think you rock. So thank you so much for being with us.